cardiovascular system is such a wonderful system wherein there is an important three energies which are converted from each other. First is an electrical energy which is converted to mechanical energy, which is then ultimately leading to the kinetic energy. Okay. So I think most of you have listened to this for the first time. It's such a good and such a wonderful concept wherein if we understand this particular flow of chart, then it is very easy for us to remember most of the cardiovascular concepts. So what do you mean by this electrical activity or electrical energy? Electrical energy is nothing but the impulse production and propagation. Electrical impulse production and propagation. The mechanical energy is the heart which is contracting, resulting in pumping of blood. The kinetic energy is the flow of blood from ventricles into arteries and throughout the body. Okay, so electrical activity is converted into mechanical activity, which is ultimately leading to the production of kinetic energy, here with which the cardiac and the vascular, okay, the cardiac and vascular is connected. Cardiac and vascular system is connected through this flowchart. Okay, so that is the first point I wanted you to know. Now, are there any ways with which we can determine these energies, or in other words, are there any investigations per se which are helpful in determining these particular energies? For electrical activity, we have got ECG. For mechanical activity, we have got 2D echocardiography. And for the kinetic energy, we have got arterial blood pressure monitoring. It can be invasive or non-invasive. Okay, so arterial blood pressure monitoring, which is going to determine the kinetic energy. 2D echocardiography, it is going to look for the mechanical energy. ECG is the one which is going to look for the electrical activity or electrical energy. Okay, so with this, I would like to go to the next concept in the cardiovascular system, that is ECG. Okay, so what do you mean by this ECG? What do you mean by this ECG? Electrocardiogram. Okay. This ECG is such a wonderful tool to know how exactly is the impulse production happening inside the heart. Okay. There are certain things which are classified as conducting system. Conducting system in the heart. Conducting system in the heart. So when we write the heart in this way, so there is something called as SA node, there is something called as AV node, there is bundle of S, right bundle branch, left bundle branch, which again divides into left anterior fascicle and left posterior fascicle, and then there are some Purkinje fibers. Okay. The electrical activity of the heart, if recorded by placing certain cameras around the heart in different planes and axes, that is called as ECG. Okay, it is majorly looking into the electrical activity which is happening in the heart. Okay, so with this minimal concept, we would move on to the next subtopic in the ECG, that is, what are the different electrical activities activities which are caught in the ECG. The first is depolarization. Depolarization. The second is repolarization. The second is repolarization. And the third one is isoelectricity. Isoelectricity. So these are the three things which are seen on the ECG. Okay. So with this, what are the different waves which are seen on the ECG? Okay. We will see the different waves that are caught on the ECG. So when we draw the ECG, we have got this. This is the typical ECG that we always study. This is called as P wave, this is called as Q wave, this is called as R, this is S, and this is T. Okay. So before going into the physics of the ECG, as a medical graduate, you need to understand certain definitions and certain terminologies. Okay. There are 5 different waves. There are 5 waves: P, Q, R, S, and T. They are called as waves. That is a deflection from the isoelectric point. This is an isoelectric point. There is a deflection. Either it can be a positive deflection or a negative deflection. First point. Second point. There are some things which are called as segments. Segments. Okay. PR is a segment. S, T is a segment. Okay. Segment, you should remember it as a straight line. Whenever there is a straight line, okay. Whenever there is a straight line, that is called as segment. You have got PR segment, ST segment. Next, we have got something called as intervals. We have got something called as intervals. Intervals are nothing but wave or waves plus segment. There should be a segment and there should be a wave or more than one wave. That is called as interval. We have got PR interval. So it has got one segment, that is PR segment, and P wave, a wave and segment. PR segment. Next is PR interval. Next is QT interval. QT interval, that is Q, R, S, they are the waves, T is a wave, and there is a segment, that is ST. ST segment plus Q wave plus R wave plus S wave plus T wave is called as QT interval. And there is something called as a complex. Complex is more than one wave. More than one wave. QRS is a complex. QRS is a complex. Okay. So this much we should know. There are 5 waves. There are P, Q, R, S, and T. And there are 2 segments, that is PR segment and ST segment. ST segment and PR segment, they are the straight lines, that is isoelectric points. PR interval and QT interval. An interval is a segment and a wave combined together. It is called as interval. And QRS, it's a complex, more than one wave. If it is joined together, it is called as complex. Okay. So with this, we will move on to the next topic in the next video. Thanks for watching.